we don't strengthen our healthcare system, we are all at risk, even those of us who are privileged. In fact, we are more at risk. So it's in the interest of us in politics, you providers, to ensure that there is a seamless and very intimate collaboration to ensure that we build a resilient healthcare system for the benefit of our people. Those of you who have the privilege of working in the federal ones established by the federal government, that are supposed to be centers of excellence, must now understand the responsibility to help us pull the entire system up to the level it should be. For us, UPH means that we have been producing doctors in this state for 50 years. And during COVID, when we scanned the state for medical doctors and senior care providers, we found more than 5,000 of them, which I thought was quite profound. So if we have a core building block for a healthcare system, which is the doctor and the associated medical professional, then what is holding us back? If we've been producing doctors in this place for the last 6 to 7 decades and exporting these people abroad, then what has gone wrong? I think it's important that we must continue to emphasize and reflect on the fact that as professionals, we will not have succeeded to the extent of our aspirations if we leave Nigeria and its healthcare system the way it is today.
We're not really a political committee. I think we are more of, would call ourselves a policy/advocacy group, in that we meet to deliberate. We try to advocate for effective and sustainable, policies, especially for the tertiary healthcare delivery system of the country, and also issues concerning our welfare. So talking about welfare, sir, on behalf of my colleagues, I want to thank you sincerely from the bottom of our hearts for the support you have given to the hosting of this meeting. We've been told that the very nice accommodation that we're all staying has been courtesy of you, so I want to say thank you very much, sir. So, sir, we also want to thank you for your strides in the healthcare delivery system. Even before the healthcare, we have been informed that you are the only governor who is paying a minimum wage of 40,000 naira to your staff. So thank you very much. You're also the first governor who was paid 100% CONMES to doctors in the state. Again, we want to say thank you. We want to thank you for the strengthening of the primary healthcare sector, which is very important, because without that foundation, we really cannot get tertiary healthcare. Most of the challenges we face could have been solved at the primary healthcare level. And we hear you have been revamping, you have an ongoing revamping. Most of the PHCs in the state are being revamped, and we want to say thank you so much. And also another pillar which we have heard that you are very strong is the healthcare financing. We want to thank you for the Edo State Health Insurance Committee, Corporation Commission, which you've established, with emphasis on sustainability. So thank you, because one of the challenges which we are discussing is the fact that most of the patients we see cannot pay their bills. And without a sustainable healthcare financing mechanism, the honest truth is that the healthcare sector would not develop. In most of the industrialized countries, most of the innovations you see are because people pay and can afford, and there's enough money, for people to invest in healthcare. So I think it's a major step in the right direction, and for that we say thank you, sir. And much more, sir, we want to thank you for your support for UBTH, especially during COVID-19. The support for the isolation center, the molecular laboratory, and for the treatment, we learned that over 60% of the COVID tests in this state were done in UBTH. And that would not have been possible without your support. And also the ongoing collaboration between your state, the state government, state health sector, and the federal health sector. That's the way to go. Because unfortunately, what we see in this country is that health is treated in silos. You talk about primary health care, secondary, as if there's a whole lot of interconnectivity. If one sector doesn't work, the other one will not work. So thank you for the collaboration, and we ask, please, for more support for UBTH. Today, before we came here, sir, we were at the University of Benin Teaching Hospital, and I want to say that each and every one of us is very impressed with the giant strides that has occurred in the hospital in the last 6 years. We are impressed with our colleague, Professor Obaseki, and we believe that even before he finishes his term of office, he will do a lot more. So, sir, we really want to thank you. There's really not much to say, but the truth is that you are one of the best performing governors in this country. And politics aside, we wish you the best in your future endeavors. Thank you very much, and God bless.